my name's Amber Martinez. I'll be validating for a central line dressing change. I have the doctor's orders. I wash my hands before entering the room. Provide the patient with privacy. I'm going to walk in the room, introduce myself, and make sure that this is the correct patient. Hi, my name's Amber. We're going to be changing your central line dressing. Patient. This is the correct patient. I'm going to instruct while I'm raising the bed to a comfortable working position. I'm going to raise his head and have him in a semi-Fowler's position. I'm going to explain that while I'm changing his dressing, that he look away from the central line and instruct him not to touch the area or the sterile field. Okay, so, right, I'm going to get my sterile field, everything in place. I'm going to use this as my waistband. My gloves and my mask. I'm going to place my mask on. Good. I'm going to put my gloves on.
To allow the site to dry, and then place a biodisc over the port site.
Fix that. I have my gloves on. I'm going to remove the old dressing from the central line. While I'm removing the dressing, I am going to inspect for any redness, swelling, or irritation. I think it looks good. Still have the patient look away so he's not getting this area infected. I'm going to remove these gloves. I'm going to sanitize my hands. Get my sterile field ready only by grabbing the edges. Okay. Next I'm going to put on my sterile gloves.
Place this on the dressing, but not over the port site and not on the patient's skin. Just reassess and make sure that there's still no redness or swelling.
Still touching only the inside. I'm just trying to get that.
Lower.
Okay. Grabbing only the inside of the glove, the non-sterile area. Inside of the cuff. Slip it over my left hand. So we're going to next move everything around here so I have easy access. My hands are still sterile.
And document my findings and wash my hands upon finishing the procedure, and that is how you do the central line dressing change.
Okay. Okay, so I'm going to now clean the central line and click this.
When you were putting that on,
Clean
did
this,
it stick to your glove?
making sure to get all around.
That didn't happen in Europe?
Today's patient, this is a video on Tiffany went to dry dressing change. Check it out.
Lift this underneath, all around. Underneath, away. to discard this, my waistband. Next time I'm going to put the biodisc over that on. Going to
And then make sure that I have my
sterile.
bag.
Again, going to discard. Placing this.
Don't throw that out.
Making sure that it is centered.
Here's no, you can't use
Port lines are out. I'm going to make sure everything is down and sealed. Going to remove edges here. Okay. I'm going to use the extra piece of tape and tape down anywhere else that needs tape. So we're just gonna keep the lines down. I'm going to now take my I'm gonna label this with the time. Well, I'm also not gonna cover the window, but I'm going to first actually I'll write this down before I put it on the patient. My pen, write down the date, time, and then my initials. Place this. Making sure not to get on the patient's skin and not covering anything that needs to be seen. So I'm going to cover the patient back up. Document any findings. Going to lower the bed back down. Okay. Remove my sterile glove.
Now you're touching your sterile hand.
And since I don't need this, I'm just gonna put this in here now and keep this. Wrap this all up. Take this all and dispose of it in my waistband. I'm gonna tell the patient he could go on with his day and he could look straight again. I'm going to wash my hands and report any findings to the doctor. Thank you.